pharyngeal arch. These are nothing, these are mesodermal thickenings where near pharynx. This is for your concept. What MCQ may be correlated? Yes, your answer is the mesoderm MCQ. Now see how many total arches are developing. 6 arches start to develop. Yes, 6 arches start to develop. At the starting, how many arches? 6. Next MCQ, but remember 5th arch total disappears. Yes, so this is one MCQ for your basics for your FMGE exam. 5th arch totally disappears. So this is another MCQ. And next MCQ, due to the 5th arch totally disappears, so how many arches are persisting? If the question is asking how many arches are persisting, so your answer is 5 arches persist. So during the MCQ you have to make caution for each and every word. They are asking how many are developing at the starting phase, answer is different. How many arches are persisting, different answer. And which arch is totally disappearing, your answer is different. You have to mention a particular arch. So these are the knowledge about the arch. Okay, so now we are going to see in the same image. Can you see here? Yes, see here, within each arch, this is the ectodermal part, here is the endodermal part, and this is the mesoderm, between the ectoderm and endoderm. In this image you can see that between ectoderm and the endoderm there is the yellow color structure, nerve element, there is the red color structure, arterial element, blue color structure, skeletal element, and one more structure is there that indicates the muscular element or muscle component. So what I want to say, yes, you can prepare the notes. Within each arch 4 components, or you can say 4 elements develop. So what are these 4 elements? Yes, what are these 4 elements? Your answer, within each arch 4 elements are developing. Yes, nerve element, muscular element, skeletal element, and arterial elements. 4 structures are developing. So first of all we are going to talk about the nerve. Okay, so just see here, can you compare, can you observe this image? Again, the first bulge is the head bulge, the second bulge is the cardiac bulge, and between these 2 bulges there is the pharynx where the spatial thickenings are visible, which are known as the arches. Now see, these arches are presenting the nerve. See here what is happening. Within each arch one particular nerve is running, because this part is near the cranial cavity, so the cranial nerves are getting developed within these arches. Now see what is happening. The first cranial nerve, that is the olfactory, it is busy in smell function, so it will not incorporated for the pharyngeal arch. Second cranial nerve, that is the optic nerve, which is busy in the vision function, so the second nerve will not get developed within these arches. Now third, fourth and the sixth, you know, all the muscles of the eyeball, they are supplied by the third nerve except SO4 and the LR6, except superior oblique and the lateral rectus muscle, which are supplied by the trochlear nerve and the abducens nerve respectively. So this third, fourth, sixth, they are also not developing within the pharyngeal arch, they are busy in the eye. So now the next nerve, which is the next nerve? Yes, fifth nerve is remaining. Yes, you know, fifth nerve is having the 3 division: ophthalmic division, maxillary division, and mandibular division. This mandibular division is running within this part. Yes, the mandibular division is running within the pharynx part. So can you compare in this image? Yes, this is the one big nerve which is having the 1, 2 and the 3 gemina, 3 couple. So this is the ophthalmic, this is the maxillary, and this is the mandibular nerve. So can you see the mandibular nerve is getting developed within the first thickening, first arch. So which is the nerve of the first arch? Yes, your concept is first arch nerve is the mandibular nerve. Now the sixth nerve again I can tell you, you can recall the sixth nerve is busy in the eyeball. So next nerve is the seventh nerve. So can you see the seventh nerve is getting developed within the second arch. So the nerve of the second arch is, your answer is the facial nerve. Now can you see this is the third arch, eighth nerve, the next number is the eighth nerve, but eighth nerve is busy in hearing function. So the next number is ninth nerve. So the ninth nerve is getting developed within third arch. So third arch nerve is the ninth nerve, glossopharyngeal nerve. Now the fourth and sixth arch nerves, yes, the fourth and sixth arch nerve, that is the vagus nerve. But later we will see in the larynx part, this vagus nerve is having the two special branches, yes, superior laryngeal branch and inferior laryngeal branch. This inferior laryngeal branch is better known as recurrent laryngeal nerve. Superior laryngeal nerve is supplying the larynx from the above, that's a superior. Another nerve is supplying from the below, but it is changing its direction. It takes the recurrent course, that's why known as the recurrent laryngeal nerve. Getting the point? Yes. So these are the two nerves. Remember, the superior laryngeal nerve again divides into the inside laryngeal nerve, internal laryngeal nerve, while the outside laryngeal nerve, that is the external laryngeal nerve. The external laryngeal nerve will supply the cricothyroid muscle. We will see in our larynx part. But what I want to tell you, the vagus nerve is the nerve of the fourth and the sixth arch, but the better answer, according to the Langemann, according to the Larson, according to the Gray's Anatomy, the nerve of the fourth arch, better answer is the superior laryngeal nerve. You can opt the external laryngeal nerve also, while the nerve of the sixth arch is the vagus nerve, but better answer is the recurrent laryngeal nerve. So yes, here the fourth and sixth arch nerve, they are indicated by the vagus nerve. So what we have studied till now, the pharyngeal nerve. So you can prepare your notes. Yes, pharyngeal nerve, the first arch nerve, mandibular nerve, MCQ. Yes, second arch nerve, your answer was seventh nerve, MCQ. Then third arch nerve, your answer is glossopharyngeal nerve, ninth nerve. Then fourth arch and the sixth arch nerves, yes, both are vagus, but according to the standard textbook, better answer is the superior laryngeal nerve and recurrent laryngeal nerve. I will show you this fact later, but just one diagrammatic presentation. Suppose this is the vagus nerve. So this vagus nerve is supplying the larynx. Diagrammatic presentation. Suppose this is the larynx and here is the position of the vocal cord. So this vagus gives one branch which is supplying the larynx from the above. So this nerve is known as superior laryngeal nerve because it is supplying the larynx from the above. Yes, it is the branch of the vagus, while another nerve is supplying the larynx from the below. Yes, inferior laryngeal nerve because it is supplying from the below, but the better terminology which is used, that is the recurrent laryngeal nerve. Why it is known as the recurrent? Because it is first going downward, then again it is going upside. That's why this is the recurrent laryngeal nerve. So remember, this is the nerve of the fourth arch, while this is the nerve of the sixth arch. Now see again more detail little. Yes, superior laryngeal nerve divides into the two nerves. One nerve goes inside, that is the internal laryngeal nerve, while the another nerve runs outside the larynx, that is known as the external laryngeal nerve. And we will see in the larynx part that this external laryngeal nerve will supply the cricothyroid muscle. So with the help of this diagram, we have solved that vagus nerve is having the branch. What are the branches? Superior laryngeal nerve and the recurrent laryngeal nerve, 2 MCQ. And again the superior laryngeal nerve is dividing into the internal laryngeal nerve and the external laryngeal nerve which supplies the cricothyroid muscle. So these are the various MCQs, 1, 2, 3, 4, and this is the fifth. So these are the few MCQs in the simple way. Better in detail we will see in our embryology part. So this is the one part of the pharyngeal arches, pharyngeal nerves. We have discussed just about the pharyngeal nerves.